Catholic bishops, hospitals, and universities still up in arms over President Obama requiring them to provide free contraception under his health care plan. But what's most unnerving about all this is the absolute certitude with which the president is exercising what he sees as his authority under the new health law. The president's chief of staff, Jack Lew, seemed almost surprised when asked about this authority by Fox News' Chris Wallace yesterday.
The president has the authority under the Affordable Care Act to have these kinds of rules take effect.
Wow. So if the president has been granted the authority to do what he wills on this issue, what else does the president think he can mandate? Joining us now is health care advocate and former New York Lieutenant Governor Betsy McCaughey. Am I correct to be concerned about this, Betsy?
Yes. First of all, the executive branch, the Secretary of Health and Human Services, who reports to the president, does have the authority to make all the big decisions about your health care, what your health plan will include, how much you have to pay for it, and most importantly, what your doctor can and cannot do.
And you is writ large. It's not only you, the individual out there, it's you, the religious institutions, and a lot of other institutions.
Let me make it clear. Section 3211 of this law states that insurers can pay only those doctors who follow whatever the secretary dictates in the name of quality. That could mean whether your cardiologist recommends a stent versus a bypass, whether your OBGYN does a cesarean section. So it goes way beyond defining what's in your health package.
Okay, to which I'm sure a lot of healthcare advocates out there who support the president would say, doesn't Medicare and Medicaid already do that? Aren't there guidelines that are put out there already for Medicare and Medicaid patients and the doctors?
This is different because for the first time in history, the federal government is given the authority to dictate how doctors treat privately insured patients. So even if you have Aetna or Cigna and pay for the entire health plan yourself, the government is still in charge of your care.
Now, were you concerned, obviously you saw some of this coming because you've been warning this would coming for quite a while, but did you think that he would take on this issue and actually take on the Catholic Church in the way he has?
I didn't expect it, but here's what's so astounding about this. Even though the statute law gives him the authority, there is a higher law, the Constitution, and the First Amendment says government shall not make a law that interferes in how you practice your religion, and it should be guaranteed in the statute law.
Didn't opponents of this law, see, I know it's 3,000 pages long, and you're one of the few people that have read through it, but didn't enough people who were against this bring this up to the American public before it was passed?
Yes.
I mean, was it buried in, did you have to read in between the lines to see that this was going to happen?
Well, for this particular issue, you had to recognize that when the secretary has the power to define essential health benefits, that could include contraception. But in fact, the pro-choice community went to bat against this. There was something called Pat Pick's Amendment that was defeated.
We remember that whole thing with Stupak. Yeah.
Exactly. But here's the irony. For decades, pro-choice women's groups went to the barricades to prevent government from dictating to their doctors or having access to their health records. And now they're supporting a law that does both.
Yeah, it's flipped. The bottom line is whenever you have a coercive branch of government, you have problems. And it depends whose ox is being gored as to who screams the loudest. But the fact is that this is about coercive government.
And let's be clear, women have access to contraceptives without getting them in their health plan. You walk into the drugstore and you buy them like toothpaste or mouthwash. The insurance plans will still cover your visit to the doctor to get the prescription, which is all you need to have access.
And it's all free. And we're going to be talking about the economics of all this coming up. Betsy McCaughey.